Thanks, Jim, and good to listen to the fascinating talks. I've been here all afternoon, and it's been super, I have to say. It's a shame there wasn't more time for the discussion, but that's always the way. So I'm going to give you a quick spin through some of the hot topics in my world, which is a mix of postgraduate education and, of course, touches significantly on undergraduate education as well, particularly across the whole Southeast. That picture shows clearly the world that Jim and I were in. That's one of my teaching rounds, clearly from the 90s. And of course, the deanery is the building on the right, not quite the deanery building that I'm in. If I could have the next slide, that would be great. Okay, so of course, all of us have been struggling, working, facing the challenges of COVID. And now we're in the midst of lots of staff still being affected by COVID, lots of patients with COVID, and yet we've got to recover and restore, particularly from all the waiting list pressures, but also from my perspective, the education and training that has had to change, and in some areas been done much better, but in other areas there are gaps, particularly in the craft specialties. Next slide, please. And right now we're in the midst of the GMC National Training Survey for the next 4 or 5 weeks. It runs for 6 weeks. If I could have the next slide. And what we know from over the last few years, and it's not rocket science, and you might think it's stating the obvious, but morale has been hugely impacted. Lots of our doctors in training and lots of our doctors who are supervising are tired and worn out. Morale is ground down. People feel burnt out and undervalued. Next slide, please. And then, as you can see, larger numbers of trainers feel that they're exhausted, that their work is not necessarily that highly valued, and they find it impinging majorly on time outside work. Next slide, please. So it's clear that the background has changed a huge amount particularly over the last 2 years, of course, because of COVID. And it's vital that we acknowledge the pressures that everybody's working on in the system and signpost our trainees and our students to the fact that it is a stressful area where you're working. There are unique pressures, and it's perfectly normal that you will feel that you will potentially experience stress. You may feel very anxious about things. And there is lots of help and support available, lots of ways to deal with that. And that's a very important part of all of our roles, I would suggest, wherever we are based. I'm going to touch on these areas just to give you a few headlines, if I may. If I could have the next slide. And it's about maintaining quality during service recovery, and what have we learned from COVID, and how are we using that? Next slide, please. And part of my job has been to convince the Treasury that we need more money to actually make good some of these gaps that have developed because of COVID. And perhaps it won't be as a surprise that that's quite a difficult job, because the Treasury does not like to give out money, and certainly not necessarily to doctors or other healthcare workers. But if you just look at the kind of graph, that's the slide that we use particularly, which essentially shows that if you stop training, if training is delayed, be that medical student, postgraduate, doctor in this case, the actual complexity and the contribution to service to an extent plateaus. And so you don't get the contribution to the NHS, to patient care that you get if you can continue to develop the potential of our students and doctors. Next slide, please. And in fact, we then translated that. We took the example of internal medicine simply as an exemplar of how to go about that. And we were able to calculate and convert that into monetary terms, how much funding, how much of a false economy is not to support education and training. And in this particular instance, purely looking at internal medicine, we were able to calculate that tens of millions of pounds worth of additional resource would have been spent if we were not able to help this group of doctors to progress to the next phase of their training. That would be in lost contribution to outpatients, lost contribution because of the need for additional locum shifts and so on. So really very significant financial modelling that has been helpful in convincing the Department of Health to fund some additional resource. Next slide, please. And what else have we learned apart from the need for some funding to do this? Well, we've learned, as I've already said, the benefits, and it's embarrassing in a way when you think about it, that in the NHS we have to kind of make a big thing of this, but actually looking after our staff and promoting well-being and offering facilities for rest, having the revolutionary idea that colleagues may need a break for refreshment or to speak to their friends or simply just to switch off from the pressure of work. We've used a lot of simulation, and we've obviously heard earlier on the fantastic work, particularly in the anatomy, from the anatomy team in Brighton. But simulation more generally has really been transformed by the pressure from COVID. And now so much of our education and training has a sim element to it, which is very much welcome. And learning to inform some key reforms about how we actually develop, in this case, induction and so on. So, for instance, we had the interim year one trainees. So these were the final year medical students who were fast-tracked, in effect, through their final few months and became interim foundation year one doctors several months early. And that was a great success because it provided a much better, much more comprehensive, hands-on apprenticeship style several month period, which is now being looked at very positively, I think, by the GMC amongst others, to incorporate this into the way forward for all future newly qualified doctors, to have a much longer running period to familiarise the doctors with the work that they'll be carrying out in the NHS, which we know is a very stressful time of transition. Next slide, please. So that's about learning from what's happened. The next thing that's happening, particularly in Kent, Surrey and Sussex, is a very significant expansion in training opportunities. So this is a really, really great time to be in our fantastic region. Next slide, please. And so just to give you an example, foundation training. So the foundation training, as everyone knows, this is the vital first 2 years after qualifying as a doctor. So a very important period where young doctors learn to manage patients at the sharp end of the NHS and start to think in more detail about their future career plans and where they'd like to work, what life might look like longer term. So this is a very important formative period. And in Kent, Surrey and Sussex, this foundation programme, we have about 1,000 trainees in that category at the moment, and that's expanding by nearly 40% over the next 3 years. So we're going from 1,000 to about 1,400. So across all of our trusts in primary and secondary care, we will be expanding the opportunities. And this, I think this is fantastic because doctors at this stage of their training, we have the opportunity to give them such a good experience that they will then choose longer term to stay in our area. And we've already heard of the great challenges in recruitment and retention in some of our mental health trusts, and indeed all our trusts have a big challenge to make sure that we can attract and retain the doctors and all healthcare workers that we so badly need. So the expansion of foundation is a great step forward for that. and we're the largest growth area in the country as regards this. Next slide, please. In addition to this, we're expanding across all of the medical and surgical and mental health specialties, as you can see. There is additional funding going in, and there's been a particular expansion in psychiatry training posts, courtesy of the NHS long-term plan, and also in cancer-related activities, particularly radiology and oncology. And again, KSS is one of the biggest expanded regions as regards that. Again, really important, because these are vital specialties in the modern NHS, and they've been significantly underprovided in KSS for decades. And at last, things are starting to change to make a difference that we will all benefit from. We being me as a future, possibly even a current patient, who knows, but we will all benefit from that as patients and citizens of the area. Next slide, please. And then the next slide. This next slide shows, again, what you would think is obvious, but research has proven it, is that where you train as a medical student and a junior doctor materially impacts as to where you stay, where you practice longer term. And it's pretty obvious in a way, but here's the evidence. This is a kind of scattergram. It looks as though somebody's thrown ink onto the picture, but in fact, this shows how far people travel from where they train and qualify, and they tend to stay within a few miles of that. Not everybody, of course, but there's a large impact of that. And this is one of the reasons why we're so delighted, one of many reasons, to have a second medical school in Kent and Medway, because we are confident that not only will that increase the opportunities for widening access, of course, to medicine, but it's highly likely to have a very positive, beneficial impact on healthcare training more generally in Kent and beyond. Next slide, please. And on top of that, we are looking at the current distribution of training posts. So I've chosen child and adolescent psychiatry because this is one of many areas where the provision of services really nationally is poor, but it's especially challenged in Kent, Surrey and Sussex, I would suggest. And the picture on the left, the map on the left, shows that KSS historically only has 2.4% of the training posts funded by Health Education England, whereas we should have 7.8% on the basis of our population and our deprivation indices and other relevant measures. So that means over the next 5 years, our share of that will move towards this level, because there is a very important piece of work that's now started to redistribute the current number of training posts in England. So for CAMS, that will mean probably a tripling of the number of training posts we have. So if I could have the next slide. This shows the impact for obstetrics and gynecology. So our numbers will go up by about 24 higher training posts over the next 5 years. So quite significant rises. That's about a 30% increase on our current numbers. Next slide, please. And more generally, as you can see from the kind of headline in the middle, over the next 5 to 6 years, we will gain. We're set to gain about 800 additional training posts across all specialties, purely to correct the long-term historic inequities in the system as it is at the moment. And in addition to that, we've got the foundation numbers that I've already mentioned. Those foundation numbers partly reflect the new medical schools that opened in 2018. And as they produce graduates from 2023 onwards, 1,500 or so, we will have a good share of those longer term in Kent, Surrey and Sussex with further training opportunities for those doctors. So that's all very positive. Next slide, please. We'll skip on this one. It just reinforces the point. Next slide, please. Okay. What else is changing? Well, there are multiple new curricula that are coming into operation from this August, particularly in the medical specialties. And the major change is the incorporation of more generalism, particularly in general internal medicine, in many of the specialties, particularly areas such as neurology, palliative medicine, cardiology, renal medicine. As you can see, these are all specialties that historically have not engaged in a large way with general medicine, and that's set to change so that patients have a better, kind of more holistic view given to them, even within their subspecialty area. Next slide, please. And so the benefits are to more accurately reflect the complexity of the current healthcare landscape, the health inequalities, whole patient care. Next slide, please. And particularly looking through the lens of population health needs and using the information and the insights brought from public health. So we are keen to see that golden thread of public health awareness, digital health awareness, serving deprived population awareness right through our curricula. Next slide, please. So you can see a time of great change. What else is happening? Well, there's a program of work that I've been heavily involved with. I chaired this working group on enhancing junior doctors' working lives. So this is a national bit of work. Next slide, please. And this is looking at what can we do to, and I've seen some of the questions flashing up as I've been speaking. What can we do to keep doctors and others in the system rather than feeling burnt out very quickly and wanting to go off and do other things that may or may not be good for patient care, as it were. And so the Enhancing Junior Doctors Working Life is designed to address some of these concerns, to turn the tide, if you like, of the pressures that doctors, in this case, are facing. And it's all about increasing flexibility. It's all about reducing the rigidity of the system, which clearly has become rigid over the last several decades, really. Next slide, please. So we've increased the less than full-time training opportunities. So now the so-called category 3 means that anyone can request to be less than full-time in training, and without any particular reason being required, simply because of work-life balance, which of course is a good enough reason for anything. Next slide, please. There's quite a few things here. We've also introduced the out-of-program pause. So this allows trainees to just spend time out, perhaps gaining more clinical experience, but away from the pressures of the curriculum and away from the pressures of the e-portfolio and the intense assessment that goes with it. Next slide, please. We've brought in supported return to training. So that if a trainee goes out, for instance, on maternity leave, due to ill health, due to a period of research, and then comes back into the program, it's very important that we make sure there's a bespoke return to training package offered so that trainees come back, can get up to speed in a very safe, supported way. And that's what we now offer to all doctors who come back in from training who've been out for any period. Next slide, please. We've got dynamic recruitment, which simply means that we'll be more flexible about start dates, so that we'll have more trainees starting throughout the year rather than just in 2 set periods, which again, I think is very helpful. Next slide, please. We've changed the system of the annual review of competence progression to become a virtual activity, which is courtesy of COVID, of course, but we'll be keeping that long term. And instead of relying on how much time have you spent in the specialty, how many assessments have you got signed off, how many X, Y, and Z have you carried out, it will be a much more holistic judgment at the assessment period, which is more realistic and gives much more credence to the importance of the education supervisor. Next slide, please. And we're spending a lot more time listening to what our trainees are telling us. So we have local, regional and national trainee engagement fora where the trainees come and meet us, the reps meet us, any trainee can come to the events and we get direct feedback. We then follow that up with a meeting a month or so later, responding to the issues that they've raised and seeing what else is causing difficulty. And that's been very helpful. Next slide, please. And the focus on well-being, which I said at the beginning, really, really important because particularly mental health issues are really affecting all of our healthcare workers. Next slide, please. And never forgetting the importance of thinking about and embedding and it just becoming natural practice to always be aware of equality, diversity and inclusion issues because this impacts on everyone. And we already heard some discussion about differential attainment, which again is a major piece of work across Kent, Surrey and Sussex over the last year and for the next several years ongoingly. Next slide, please. I think we'll skip on this just to say that we've got a pilot scheme in Kent, in Margate, looking at the challenges, particularly of remote and rural working. So we can skip the next 3 or 4 slides just to keep going. Keep going. Yep, keep going. Keep going. Yeah, keep going. I'll come to the next one after this. Yeah, just to say, what else is happening? Well, we are moving, Health Education England is being incorporated, is transitioning into NHS England and improvement. What does that mean? Well, famous last words, I think it will be a good thing for Health Education England because workforce challenges are a major issue for the NHS and workforce is what we spend most of our time supporting and developing and thinking about how we can get things better. Not just medical workforce, of course, but the whole cross-section of healthcare workers. We're good at that, and that's what we will be doing more of with NHSE and I. And I'm quite sure that the progress that we've made so far will be maintained and enhanced with NHSE and I. It's a good thing, it really is. KSS Deanery will be further developed. We are setting up our own foundation school, so we're separating from London completely by next August from a foundation school perspective, so that's good news for our doctors. The undergraduate medical tariff is changing. Again, we can discuss that after if colleagues want some more detail. And we're setting up a whole array of fellow posts so that we have a more organized structure for these opportunities for our young doctors. In a way that gives them a different experience. It might be leadership or quality improvement. It might be in more research-based posts, but it will be better organized. And we hope it will offer another positive reason to stay within KSS, particularly around Kent and particularly around Sussex for obvious reasons. Next slide, please. What's happening in primary care? Well, primary care is incredibly important. The numbers of opportunities for training are going up exponentially. KSS is fitting very well. The program's changing to have 24 months in primary care and 12 months in secondary care during training. And a lot of the future support for our general practitioners is being organised through the training hub system, as it is for the wider healthcare team, all of whom need to spend more time learning and then practicing within primary care, moving out of secondary care in many instances. Next slide, please. So I think we're on the final slide here. So the moral of the tale is it's about trainee and trainer well-being and support. It's about thinking how different the world is going to be. So for instance, I think 80% working 4 days a week equivalent. it will be the new norm for doctors in the future. There's going to be huge expansion of numbers. We absolutely must make sure all doctors in the system are offered support and development, and that we keep a tight focus on the benefits of differential attainment and the work that's going on in a large scale. We absolutely are building on what I've described as the feel-good factor from the Kenton Medway Medical School and Brighton Medical School. The impact that has on the healthcare community is potentially enormous. Having learnt some lessons from COVID, having learnt to make use of all opportunities for training, be that in the independent sector, simulation, retired educators, and so on, and to develop further generalism and population health opportunities. So this is a great time to be in healthcare education and training, but time is the key thing. We must finally, I think, protect educator time within a very, very busy, pressurized NHS. And that's a big bit of my job, negotiating with trust, chief executives, and so on, to make sure that that is carved out, because that's the way we will protect the positivity that young doctors bring to the system, and that we must develop further. So thanks, that's me done, but really happy if there are any questions, of course, to respond.